my name is Shelly and I'm going to be performing complex wound care. So I'm going to start off by doing a 360 of the room. Okay, perfect. And then I'm going to start off by entering my patient's room. When I enter my patient's room, I'm going to wash my hands, perform hand hygiene, wash my hands. I'm going to put on hand sanitizer. It's good. Perfect, and then I'm going to walk over to my patient and I'm going to introduce myself, get patient ID, and also consent. So, hi, my name is Shelly and I'm going to be your nurse today. I'm just going to check your ID band. So what's your name, date of birth, and age? Perfect, so this is Samantha Williams. She's 22 years old. She was born November 6, 1998. Okay, Samantha, today we're just going to be doing a dressing change. Is that okay with you? Perfect. So we obtained consent. As I obtained consent, I'm going to move my patient waist level so it's ergonomically ready. Also, I'm going to do that for my table as well, where I'm going to have my sterile field open. I'm going to put it up to waist length, okay? Perfect, and it is up to waist length, both sides. So then starting off, I'm going to use this absorbent pad underneath my patient, and I'm going to put this underneath my patient. So just remember, blue on the bottom. I'm just gonna put this underneath. So just remember that in the real world, we would just tip over our patient so that any type of irrigation or any type of blood would come down and it would go onto the absorbent pad. Okay, perfect. After that, I'm just gonna get this little dressing tray out, and I'm going to make myself a little garbage bag. So I'm going to actually take this in between my patient and my sterile field, so then it's easier for me to actually put it in between. Perfect. Okay, I have my garbage bag. After that, I'm going to remove the dressing that was previously put on Samantha. Okay, I'm gonna apply clean gloves. Okay, Samantha, as I take off your little dressing, it's going to tug a little bit at the tape, okay? Okay, as you take off the dressing, as you take it off, you have to check the color, the size, the odor of the actual amount that's on there. And then for my patient, actually there is a quarter size. It's red, and it's dark red, quarter size, and it's odorless, so that's good. Take that off. And then I'm going to take off the packing wound over here. So just make sure when you're doing the packing wound, you take it out and document any findings. If the patient is moving at all, or if there's any pain when you're taking this off. How are you feeling? You're feeling good? Okay, on a scale of 1 to 10, how is your pain level right now? A 2? Okay, that's perfect. So her pain level is really low. That's perfect. Now we can start off. We can start our routine. I'm just going to take off my clean gloves, and then I'm going to move my dressing tray over. And this has all the information of the dressing tray. So you can grab as much as you need and as much or little you need if you need it or not. So I'm gonna open up my dressing tray. Just make sure the border, the 1-inch border around the dressing tray is sterile. These are sterile tongs. Okay, perfect. Sometimes it can be a little wonky on the sides. That's okay. Using this 1-inch border, you can always move it. So these are my sterile tongs. I can only put it from the little nubbins down. It's going to be non-sterile. So now I'm going to start adding on and moving stuff around in my sterile field. So what I'm going to do is I'm going to move this out. I'm going to put a few of these little 2x2s on this side because I'm going to use these later. Okay, and now I'm actually going to put in some normal saline. So just a little disclaimer, I didn't actually get my suture removal kit in my actual Seneca kit, so I'm just going to be using my own sterile suture, like their suture kit. So I'm just gonna banana peel out my kit. These are my thing. I'm gonna take these out. So this part is non-sterile and the inside is sterile. So I'm going to place these on this side, okay? And now that we have that, I'm going to, and this is going to be my normal saline, which I didn't get in my kit as well. So to add the normal saline, you put your hand on top of the label, you lip this a little bit, and over your sterile field, making sure that it doesn't splash around, put it in where you need. I'm gonna put it in here for my packing wound, and then here so that I can clean around the wound. Perfect. And now I can label, and at the end I can label what time I used it and how long it was out for. Perfect. After that, I'm going to place anything else that I need. So I'm gonna banana peel everything out. I'm gonna get my syringe, throw this out, banana peel my needle. Okay, out, perfect. I'm going to take, another method is using your sterile tongs. Put these out. I'm gonna grab another one, just in case a mistake happens. There we go. Perfect. Throw everything out. I'm gonna take my abdominal pad out as well. This one's a little tricky, so I'm just going to throw this out as well. Okay, I don't think I need anything else, but I'm just going to take my packing strip and I'm going to take as much as needed. Eyeball it to the point where it was from the previous amount of packing strip that you had. So I'm just going to put it directly inside the normal saline that we used. Okay, perfect. I think that's enough. Okay, now I'm gonna, using my sterile scissors, I'm gonna cut off the edge. Perfect. And now I'm just gonna put the cap back on, put this to the side. So I think everything I need on my sterile tray is good. So now I'm going to actually put on my sterile gloves. This out. The outside of this is non-sterile, so I am allowed to touch the outsides, but just being careful with a 1-inch diameter. Alright. There we go. Could be tricky. Okay, so just opening it and putting my dominant hand in. I'm going to pick up my sterile glove, tucking my thumb in. I'm gonna wear my sterile glove. The inside of the glove is non-sterile, so that's good. Since this whole hand is sterile, I can pick my glove up, tuck my thumb in. This is my non-dominant hand, and I can put my sterile glove on. Perfect. Now that my sterile gloves are on, I cannot touch anything that is non-sterile. So to start off, what we're gonna do, we can, now that we have our sterile gloves on, I can touch my sterile field. I'm gonna start off with my syringe, add my needle to it, take this off, and I'm going to add a syringe full of normal saline. Perfect. I'm just gonna plop a little bit back in there. Since this is all a sterile technique, I'm gonna move over to Samantha. Samantha, you're gonna feel a little bit of cold water or normal saline water type, and I'm gonna irrigate in a zigzag formation until I see a clear return. Irrigating. There we go. Now that we have all of it irrigated, I'm going to actually take this and put this in the Sharps container, which is on that side. So now that that is done, I'm going to actually clean around the wound. So what I'm going to do, I didn't use those because those are non-sterile. So I'm going to use my sterile tongs inside my tray. So now that I have some normal saline inside my little 2x2s, I'm going to dip it in, wring them out, Actually, there's too many in there. Yeah, I think this one. What I'm going to do, wring them out. So I'm going to take this side and this side, and then I'm going to throw this out, maintaining sterility. Now I'm going to do the top and the bottom, so I'm going to wring these out. 1, 2, so top and bottom. And I'm going to put this in the garbage. Okay, perfect. So now that the normal saline one is there, I'm going to actually take the clean ones and I'm going to actually dry the sides of the wound. There we go, throw it out. Perfect. Now I'm going to do the tops of the wound. This is my dry 2x2s. 1 and 2. There we go. Alright, after that, I'm just going to move this on this side. I'm going to take, okay, since I have this, I'm going to measure my wound as well. So I'm going to take my little wooden spoolie and I'm going to actually measure the length above it. I'm not actually going to touch around, and I'm going to use my measuring tray right there. It's around 3 inches, and now the width is around 2 inches, and then the depth, actually, being very careful, is 1.5. Okay, so I actually don't need this. I'm just gonna throw it out. So that's it's gonna be 3x2 length, width, and then depth is 1.5. So now that we have our measurements, you can keep those in mind. What I'm going to do is actually wring out my little packing dressing. Do all that. I'm actually gonna use my hands because it's easier. Just making sure not all of it's out. That's it, 1 ring is fine, and then I'm just going to wrap it around my hand so then it's easier to put inside the wound. Okay. Perfect, now moving over to my patient, I'm going to start packing the wound. Okay, being slow, I'm going to maintain sterility, pack the wound, making sure I'm touching nothing around it, and perfect. Now that my wound is evenly packed, that's perfect. I'm just gonna put my 2x2s on top. Okay, and then I'm going to put my abdominal pad on top of my patient. Since it's impossible to use gloves and put tape on, I'm going to remove my sterile gloves and throw them out. I'm gonna grab my tape and tape up my patient. So, perfect. Now that my patient is all taped up and perfectly fine, I'm going to clean everything up. I can apply hand sanitizer, wash my hands, put this in the shards tray, and I'm going to date time my normal saline so that it can be used. If not, then that's perfect. I'm going to clean up my dressing tray. So that's my sterile wound care.